The liver plays a crucial role in the body by performing various important functions. When the liver is damaged, it has the remarkable ability to regenerate and repair itself. In this video, we will explore the complex mechanisms and processes involved in liver regeneration, including the anatomy of the liver, the role of different types of liver cells, and the impact of liver diseases. Join us as we delve into the fascinating world of liver regeneration and repair. The liver has the ability to repair itself when damaged. This process, called liver regeneration, involves the replication and restoration of damaged liver tissue. It is important for maintaining normal liver function and survival. Hepatocytes, hepatic stem cells, and progenitor cells all play a role in this process, which is important for developing treatment strategies for liver diseases. The liver is a complex organ consisting of lobes, cells, and functional units called lobules. Understanding its anatomy and microstructure is vital for comprehending liver regeneration and repair. Its unique organization and network of blood vessels and bile canaliculi enable its regenerative capacity. During liver regeneration, hepatocytes are the primary cells that multiply. However, hepatic stem cells and progenitor cells also contribute. Hepatic stem cells are rare and can become hepatocytes or cholangiocytes. Hepatic progenitor cells, or oval cells, can differentiate into both hepatocytes and cholangiocytes. These regenerative cells are essential when hepatocyte replication is inadequate. They restore the liver's cellular population and function. In liver regeneration, damaged liver tissue is replenished primarily through replication of existing hepatocytes. Quiescent hepatocytes are stimulated to enter the cell cycle, undergo proliferation, and migrate to the injured site. This process is regulated by signaling pathways and transcription factors. Chemokines and growth factors guide hepatocyte migration. Understanding hepatocyte proliferation and migration is essential for therapeutic applications. The liver extracellular matrix, ECM, is a complex network of molecules that support liver regeneration and repair. When the liver is injured, the ECM undergoes changes, leading to remodeling. This remodeling affects cell behavior, such as proliferation and migration, and is important in understanding liver regeneration mechanisms. One unique aspect of hepatocytes is their polyploid nature, characterized by having multiple sets of chromosomes within a single cell. Polyploid hepatocytes play a significant role in liver regeneration as they exhibit enhanced regenerative capacity compared to diploid hepatocytes. Polyploidization occurs during liver development and contributes to the functional and metabolic capabilities of the liver. These polyploid hepatocytes can undergo cell division, giving rise to daughter cells with varying ploidy levels. The role of hepatocyte polyploidy in liver regeneration is an area of active research, with implications for understanding the regenerative potential of the liver in both physiological and pathological conditions. Studying liver regeneration in vivo is challenging due to the complexities involved in human research. However, several experimental models have been developed to investigate the mechanisms and processes underlying liver regeneration. Animal models, such as rodents, zebrafish, and pigs, have been extensively used to study liver regeneration. These models allow researchers to manipulate various factors and study the regenerative responses. Additionally, in vitro models using liver cell cultures and organoid systems have provided valuable insights into the cellular and molecular events associated with liver regeneration. The utilization of experimental models is essential in advancing our understanding of liver regeneration and exploring potential therapeutic interventions. Liver regeneration can be impaired by excessive accumulation of matrix components, causing liver fibrosis and scar formation. Fibrosis is the excessive production and deposition of collagen, hindering liver regeneration and increasing the risk of cirrhosis. Understanding these mechanisms is essential for treatment development. Hepatocellular carcinoma, HCC, is the most common type of primary liver cancer, often arising in the context of chronic liver disease. Paradoxically, liver regeneration and HCC development share common mechanisms, primarily involving deregulated cell proliferation and impaired DNA damage response. Chronic liver injury and inflammation predispose the liver to genetic and epigenetic alterations, leading to the development of HCC. Understanding the intricate relationship between liver regeneration and hepatocellular carcinoma is critical for identifying novel targets for cancer therapy and developing strategies to prevent tumor recurrence after liver resection. Liver transplantation is a life-saving procedure for individuals with end-stage liver disease or acute liver failure. The remarkable regenerative capacity of the liver plays a central role in the success of liver transplantation. During transplantation, a portion of a healthy liver is transplanted into the recipient, eventually regenerating into a fully functional liver. The regenerative potential of the transplanted liver enables the restoration of normal liver function, facilitating the recipient's recovery. Understanding the mechanisms through which liver regeneration occurs after transplantation is essential for optimizing transplantation procedures and improving outcomes for patients with liver diseases. Regenerative medicine holds great promise for liver repair and regeneration. Various regenerative medicine approaches are being explored in preclinical and clinical studies to promote liver regeneration in cases where the liver's natural regenerative capacity is impaired. Strategies involve the use of stem cells, tissue engineering, gene therapy, and small molecules to stimulate hepatocyte proliferation and modulate the cellular microenvironment to promote efficient tissue repair. Recent advances in regenerative medicine offer hope for developing transformative therapies for liver diseases and reducing the burden of liver transplantation. Liver regeneration and repair occur in various disease contexts, including chronic liver diseases, viral hepatitis, alcoholic liver disease, non-alcoholic fatty liver disease, and drug-induced liver injury. In these pathologies, liver regeneration may be dysregulated or impaired, resulting in the accumulation of scar tissue and functional decline. Understanding the specific mechanisms and factors influencing liver regeneration and repair in disease contexts is essential for developing targeted therapies and interventions to restore liver function and prevent disease progression. In summary, liver regeneration and repair are complex and highly regulated processes that involve multiple cell types and signaling pathways. Understanding these mechanisms can aid in developing new treatments for liver diseases and improving patient outcomes.